Chapter 8 Infection Control. Topic Overview of Standard Precautions. At the end of this chapter, learners should be able to understand the practices that could cause risk to healthcare workers or clients, patients, or the community. Understand the importance of standard precautions. Understand the color coding system of segregation at source as per Biomedical Waste 2016 guidelines. List out various infections transmitted through occupational exposure, for example, a needle stick injury, and to understand the need for needle stick injury post exposure prophylaxis protocol. Standard precautions. The basic premise of standard precautions is that all patients and all samples are potentially infectious. These are a set of infection control practices used to prevent transmission of diseases that can be acquired by contact with blood, body fluids, non intact skin, including rashes, and mucous membranes. Standard precaution number 1: hand hygiene. This is the single most important means of preventing and controlling the spread of infections. Standard precaution number 2: personal protective equipment. Wear gloves during blood drawing and use gowns, masks, respirators, and other personal protective equipment wherever indicated. Standard precaution number 3: spill management. There can be blood and body fluid spills in the laboratory. All laboratory staff should have adequate knowledge of how to manage these kind of spills. Standard precaution number 4: decontamination of surfaces and instruments. Avoid touching contaminated equipment. Carry out routine and proper decontamination of surfaces and instruments. Standard precaution number 5: safe disposal of sharps and infectious waste. Standard precaution number 6: immunization against preventable infections including hepatitis B virus. Standard precaution number 7: post exposure prophylaxis. Whenever there is exposure of laboratory staff to blood or body fluids, there should be a protocol in the laboratory for proper post exposure prophylaxis. There should be management of needle stick injury and other occupational exposure as well. Standard precaution number 8: management of biomedical waste as per the latest 2016 guidelines. Therefore, to summarize, healthcare personnel are potentially exposed to infectious materials like blood, tissue, specific body fluids, medical supplies or equipment, and environmental surfaces contaminated with these substances. Therefore, standard precautions need to be followed by each and every laboratory staff to prevent healthcare associated infections. Standard precautions need to be applied to option A: HIV patients only, option B: patients with hepatitis B, option C: all patients irrespective of infection status, option D: none of these. The correct answer is standard precautions need to be applied to all patients irrespective of infection status. A patient diagnosed with dengue has skin rashes and high grade fever. Standard precautions do not need to be practiced in this patient. Option A: the given statement is true. Option B: the given statement is false. The correct answer is the given statement is false. A patient with skin rashes has compromised skin integrity and therefore standard precautions need to be applied in this patient?